I'm Joseph Russell, and I'm here to talk about pediatric sports concussions and how to manage them. The American Association of Neurologists defines a concussion as any blow to the head, face, or neck, or any blow to the body that transmits forces to the brain and affects the brain itself, causing any pathophysiological functional changes. A concussion in and of itself is a functional dysfunction, not a structural. Basically, a large blow to the head gets the brain very confused and it forgets how to do its job. Some of the symptoms that a patient may experience, there are three factor symptoms: neurocognitive symptoms, somatic symptoms, and emotional symptoms. Neurocognitive symptoms are made up of things such as balance issues, dizziness, drowsiness, difficulty concentrating, or feeling as if you are in a fog or slowed down. Somatic symptoms are those that have to do with the rest of the body. So headache. Headache is going to be the most common symptom in any concussion patient. They will also experience nausea, sleep pattern disturbances, and sensitivity to light or noise. Third are emotional symptoms. Here we can find an increase in irritability and sadness and nervousness, and they may just seem a little bit more emotional than usual. So what do we do when we have a patient who's a pediatric patient and is in sports and is looking back to get into his sport? First, we have to wait until his symptoms are subsided at rest. From there, we can begin to add on any sort of exercises. The way that a physical therapist or practitioner would test to see how well they respond to exercise would be through an exercise treadmill stress test. Here we can see that we will put them onto a treadmill and we would increase the workload steadily to find out their exercise capacity and their symptom threshold. Once we find those out, we can prescribe an at-home exercise program for them and go from there.